William Stead calls himself a child of Duke, and rightfully so. As the son of legendary Duke Chair of Medicine Eugene Stead, William Stead was practically reared on the Duke campus.
I am a product of the place. I literally grew up on the campus, and I am a university and academic medical center critter.
But William Stead had little desire to follow in his father's medical footsteps.
That's what I didn't really think I wanted to be a doctor, because as best I could tell, doctors spend all their time on airplanes.
Instead, he was fascinated with computers, and as a Duke undergrad in the late 1960s, took a course in introductory computer programming.
And that really was seductive.
Stead went on to become one of the founding fathers of the field of biomedical informatics. He is world-renowned for helping to make biomedical information and technology an organic part of academic and clinical medicine. Stead's first interest in pursuing medicine came as a Duke Junior, when a work-study job placed him in Frank Starmer's myocardial infarction research unit. Starmer was testing how to integrate digital computers into the healthcare environment.
As I worked with Frank, it became clear to me that the person who was best positioned to figure out how to integrate the computer into practice was the doctor. And that's what actually made me decide to go to medical school.
Stead performed part of his third-year research before even starting medical school. Working with Ed Hammond, they developed the medical record, one of the first electronic medical record systems in the country.
The reason electronic health records are important is because they give you a way to capture data or information once and to then reuse it or repurpose it for direct care, for quality improvement, for research.
Stead later joined the nephrology faculty, where he split time between running the dialysis unit at the VA hospital and being a physician advisor to the Duke Hospital Information System.
We would use the dialysis unit as the test bed to continue to develop the electronic health record,
especially in regard to prescription management.
The simple fact of showing the clinician what the patient was on as they got ready to add something suggested to them, I better take 2 away if I want them to take this one. So we really did begin to change practice in the late 70s and early 80s with the help of the computer.
As Director of Medical Center Information Systems in the late 80s, Stead helped to fashion Duke's first patient-centered hospital-wide information system, and soon after, he was lured away to Vanderbilt University, where he has been since 1991.
Informatics is now in the DNA at Vanderbilt, so it's now the largest department of biomedical informatics in the world.
In addition to his position as Chief Strategy Officer at Vanderbilt, Stead is the chair of the National Committee on Vital and Health Statistics. He is the founding editor of the Journal of the American Medical Informatics Association, which later established the William W. Stead Award for Thought Leadership. In 2007, he was honored with the Collin Medal from the American College of Medical Informatics, and in 2000, he was elected to the Institute of Medicine. Stead and his wife Janet, a former Duke nurse, have a daughter, Elizabeth. They eschew Nashville's honky-tonk lifestyle in favor of spending time at their lake house. He enjoys water skiing, so much so that years ago he arrived at his wedding rehearsal dinner on water skis. While born and bred at Duke, Stead says there's still no other place he would rather have received his education and training.
Duke has the freedom to let you do things that haven't been done, and it is an invaluable gift.